How we do this starts as simple, and I've got thousands of examples of what recognition looks like in all shapes and sizes, all types of companies and industries. One of the books I wrote is 1,501 Ways to Reward Employees, 100% real life examples. It's all over the map. But if there's just one thing that you focused on and got all your managers to focus on, it's this: personal and public praise, thanks and praise. And that could be in person, in a written note, it could be electronically in voicemail or email, it could be in public, in staff meeting or for the company meeting or something in the community even. But this is the home room for this topic. And I did research on 52 explicit behaviors across industries to say what is most important for employees to be motivated. I'm asking employees directly, and out of 52 potential choices that I factored into a dozen factors, combination of related variables, we're looking here at 4 of the top 10 are types of praise. And initially in the research, I said, well, isn't this all one thing? Isn't praise praise? Whether it's in person or in public, that's one bucket. What I've learned and what I want to share with you is that, no, it's not one thing. Each of these items are mutually exclusive. That means, in a nutshell, that it's something different to thank someone personally to their face. That's different than if you write them a note, or whether it's a Post-it or a formal letter, something that they can take home and share with their family or put in their victory file, so that when they have a bad day, they can go back and reflect on the great job they've been doing. It's different than getting a voicemail that someone's going to listen to 3 or 4 times, or having something said in public about you in front of others. That is very validating as well. So you got to fire on each of these cylinders to maximize the power of this topic of recognition.
And overnight, our entire model for delivering healthcare had changed. Med-surg nurses became ICU nurses. Pediatricians were caring for adults. Outpatient staff at all levels of the organization, from managers to RNs to clerical staff, became frontline caregivers. A cadre of staff were runners, so that the nurses never had to leave the units. Support staff stepped in more ways and more areas than we could count. Everyone helped everyone else. Managers connected with their employees in ways we had been begging them to do for years. They were spending more time on the floors, less time in their offices, supporting and educating their teams. The number of manager recognitions on our recognition platform doubled. Every day, stories of heroism, creativity, and resourcefulness were told at our organizational huddles and retold at our department huddles. And the staff looked out for each other. The number of peer-to-peer recognitions jumped up as well. We instituted a feed from the social platform on WorkProud that was displayed in the cafeteria so that employees could see other employees being recognized. It went viral.